Perfect. So I'm going to turn my video off, but yeah, just have fun with it. Just
Okay.
be your lovely self. Just, hey, everybody, welcome. Thanks for joining. All right.
Yeah.
All right. I'm going to count you in. And you look great. Your background's perfect. So yeah, have fun. You're going to be live. I'll say 3, 2, 1, you're live, have fun. Just wait a second and then say, hey, everybody. Okay.
Okay. Sounds good.
All right. You're going to be live in 3, 2, 1. You're live. Have fun.
Hello, everyone. My name is Sheel Patel. I am a recent graduate of general surgery program at the Detroit Receiving Hospital, and I'm currently doing my thoracic surgery fellowship at University of Kentucky. I am a senior MST tutor, and I've been with MST for about 7 years. And I will say I have loved every second of it. I love interacting with all my tutorees, and I love teaching. To start with, the point of today's webinar is for me to talk a little bit about what are the expectations and what was my strategy in taking the most recent ABS surgery certifying exam. So I will talk more about what is part of the ABS surgery board exam in a little bit more detail in a few. However, I have been through this process. I know it's very overwhelming and I know it can be very stressful, but just know that we are all here to help you in whatever way we can. So let's get started. First of all, I just wanted to talk a little bit about who are we. So MST has been there for quite a long time, and the goal here is for us to provide personalized online tutoring to all the tutorees that are interested. We have had over 15 years of student successes, and we have a lot of pride in that because every time a student succeeds, we feel accomplished in our goals. Who is included as a part of MST could be students, it could be residents, it could be attendings, and could be fellows like myself. Again, we have been through where you are, and we have succeeded, and we also love to teach. That's why we are here. What are we going to talk about today? So, while going through my certifying exam, I had to go through a lot of process to make sure that I succeed, right? So there were a few points that were very important to me. Some of them included how to do studying. What are some studying and timeline tips? How do I find time during residency to study? What about the ITE scores, the in-service exam that you take? What about those? What about surgery-specific resources? Are there specific ones that I like? And then we will do a Q&A at the end. Before I move along, just be aware that there is a chat box associated with this webinar. So if you have any questions, please go ahead and write in there. I will try my best to answer them. However, I may not get to them till the end. So to start with, the first thing we're going to talk about is some studying tips. So, going through the 5 years of surgical residency, general surgery residency, I realized that it's not just 1 year at a time. Actually, it's all 5 years together. However, you have to start from day one. You can't think, okay, you know what? I'll study tomorrow. I'll study tomorrow. I'll study tomorrow. And before you know it, those 5 years are gone, and you are a day before you graduate, and boards are going to be in 15 days after that. So the first thing you need to do is you adjust expectations. You have to realize you're in a very time-demanding residency. You are not always going to have all the hours of studying that you think you need or you think you may want. So you need to adjust your expectations and take advantage of every single minute or moment you might have. Also, something I want to point out, something that I don't think I was completely successful myself, but I very much encourage is to start preparation for boards early. Like, don't wait during the last few months of residency. Practice, studying, repetition all starts day one of residency. And the more you repeat yourself, the easier the last few days before your boards are going to be. What I mean by that is there is something known as SCORE curriculum out there. I use SCORE because that's what my program encouraged, and I absolutely loved it. Your program might make you do something else, which is okay. The point of this is that you have to keep up with something or the other throughout the residency. So for me, there was SCORE, and every week in SCORE, there would be a new topic that SCORE pointed out. And I tried to make it a point to at least go through the assigned 10 questions every week. Now, if I had more time, I would definitely do more questions. But as you all are aware, surgical residency can be different on day-to-day basis. So you may not get time today, but you may get time tomorrow. So try to take advantage of that time, because you do not know how busy your third, fourth, or fifth year is going to be, so that you can be prepared when you get there. And also something I want to point out, just like in step 1 and step 2, I am sure you guys remember that when we were taking our step 1 and step 2, people would always be like, you know what, this resource is good. You know what, this resource is good. And if anyone was anything like me, I always was like, oh, I want to try this resource. I want to try this resource. However, that's not what you need to do. You have to limit your resources. Too many can make you overwhelmed, and then you get confused and do not fulfill commitment with one single source. Some of the sources that I recommend, just because I have used them, include SCORE, CSAP, TrueLearn, and I'm sure as coming from surgical residency, you might be aware of it. If not, I will definitely talk more about them. Something else to talk about is use your lighter rotations. So, when we're going through internship, even when we're going through later years of residency, there's always going to be one rotation where you just know that the volume is not as heavy. Take advantage of that rotation. Get ahead of yourself. Read more, or try and do more questions. Either way, just because it's a lighter rotation, don't give up on it, and don't say, I'm gonna try and have fun this month just because it's a free rotation. It's okay to have fun, of course. I had fun. Otherwise, how would I survive surgical residency? But you need to make sure that you're on top of it and use those rotations to your advantage. And again, as I mentioned, studying starts day 1 of residency. So what I did, or what I tried to do, was that, when I was on rounds, and if there was a topic that was intriguing me and I knew that I just didn't know enough about it, I started reading about it. I was never the person to read the textbook from first page till the end. I was always the person who tried to find an encounter or a topic or an interesting patient and read about it to get more information. Just know that you're going to see so much during your surgical residency that there's a chance you're going to read majority, if not all, of the important topics required in surgery. So some of the question banks. So, people ask me, and I've asked myself too, which are the best surgery question banks? There are a lot of options out there, a lot. I think, in my opinion, is what you choose should be something that you stick to through the end. Again, do not make last-minute changes. If you think something works for you, then I'm pretty sure it works for you because you have used it over the past 5 years. And then also something that I already mentioned was that try and group your questions on a particular patient. So if you see an interesting patient, read about it. If you see an interesting consult, read about it. And not only read about it, also read how to manage it. Also try and read some complications and how would you deal with the complications. And then once you have read about this, go to the Qbank and see if you have any questions related to that topic. The more you read about a certain topic and more you do to reinforce it, the better it will stick to you and you'll be remembering it later on. I think this strategy was particularly helpful for me as a PGY2 when I was taking ER consults, and a PGY3 when I had just become a new senior and I was responsible for the first and the second years. So I think this worked really well for me. The second option is to try and stick to SCORE or Decker if that's what your school provides you or your program provides you. And again, what this week in SCORE is where it gives you a particular curriculum, like it will give you gallbladder disease this week. And then on top of that, it will give you 10 different questions on gallbladder disease. So what I try and do is I try to read the outline of it, try to get an idea of what it wants me to know, and then I do questions based on it. There's something that you all need to understand is that all of us, just as a future physician, need a long-term plan. Our ultimate goal is to be successful surgeons. For that, we need to pass our boards. So we all need a very long-term plan, but this is especially true if you are not a good test taker or if you have history of prior USMLE failures, just because it's going to take a little bit more time, but just because you perform poorly in previous exams does not mean you're not going to ace this test. So work hard and I'm sure you will succeed. The ABSITE, which is the surgery in-service exam, is a very good mirror to tell you what your weaknesses are and what your strengths are. So as soon as I took my ABSITE and we got the report, I would look at which questions I would get wrong. If this is the first time you're going to be taking your ABSITE, once you take ABSITE, it goes through the topics which you possibly got wrong, and it will tell you the topics, not the questions, but it will tell you the topics, which means that those are your weak areas. And yes, there could be some questions or some parts of those topics that you know very well, but there could also be topics that you don't know. So what I would recommend based on those ABSITE is to do the following. As a PGY1, start learning the medicine. You just graduated med school. At this point, you need to know how to put surgery into action. Like, how does surgical consults work? When do we operate? When do we not operate? And then also acknowledging the red flags, like which topics that you shouldn't have gotten wrong, you definitely got wrong as a PGY1. PGY2 and 3, I worked on addressing my gaps in knowledge. There were several topics which I thought I knew, but when the questions were asked, I didn't know them as well. So I worked on trying and reinforcing them. And as a 4 and a 5, I tried to make a study plan for my board exam. So as a 4 and a 5, my ultimate goal was to make sure that I do well in my board exams, whether it be the written or the oral boards. So I took my in-service exam and I identified again all the weak areas from it and made a note of it. So and what I did was I started with all the weak areas and made sure that I do questions on them, I review topics on them, so that way I at least have all my weak areas reinforced before I go to other areas that I know well. Something very, very, very important, no matter which test you'll take, is questions, questions, questions. The only thing you can do for yourself is repetition. Take questions, as many questions as you can. See as many questions as you can. And if you got the question wrong, read about it. From that, you will know if you actually know the topic or not. As I said, and as I've been saying this whole chat, repetition is the key. So even if you've done the questions, refresh the entire bank and do them again. During my 4th and my 5th year, I learned from one of my seniors. I made it a point of going through the score questions, which were about 2,000 questions, at least 1.5 times before the year ended. And it was great because there were times when I would get a question right the first time, but then I got the question wrong the second time. So it just taught me the moot point of that question so that I don't make that error again. So this, as I said earlier, that I just took my general surgery certifying exam. And before I go ahead, I'll talk about it. So to be a board certified general surgeon, you need 2 exams. The first exam is the certifying exam, which is a written exam. And I'll talk more about it as to what's entailing in that exam. And the second exam is an oral exam. Again, this is like a 2 to 4 hour oral exam where they'll pretty much ask you questions based on oral scenarios, and we'll see how you deal with them. You cannot take the oral boards without passing the written boards. Some of the high yield topics that I came across while I was preparing for my boards and also while I took my boards were as follows. Of course, we're general surgeons, so expect that you're going to get a lot of questions about small and large bowels. Also, critical care is very, very highly tested topic. They love asking questions about ABCs of ACLS and ABCs of ACLS and also ATLS. And they also love asking about resuscitation plans. I probably had at least 3 or 4 questions just on airway, breathing, and which one to address first. Of course, it's not as straightforward. It's a third order question, but they're trying to get you to pick airway or breathing before you jump onto circulation. Something that's also very well tested on boards and also on ABSITE is breast disease, management of breast disease. Do you know when to do lumpectomy? Do you know when to do mastectomy? Do you know when to give patients chemotherapy? Do you know what to do with inflammatory breast cancers? And then sometimes there are questions about genetics, which is BRCA1, BRCA2 questions. Not that commonly tested, but it's good to know because they may ask you questions, again, in second or third order about it. The 2 topics that are very important in endocrine were thyroid and parathyroid disease. Again, they loved asking questions about thyroid cancers and how I would deal with it, especially the MEN1 and the MEN2 syndromes. And then I cannot forget trauma. Again, remember that you have to know the ABCDEs of trauma, and then you have to manage the patient accordingly. So what I mean by that is that if a patient you have assessed airway and breathing and circulation on the patient and you are on disability, and all of a sudden patient gets unresponsive or anything changes in patient status, you come back and you go through A, B, C's again. You don't skip A and B and go directly to C. So the questions were just to reinforce that you know that information. Some other topics that are also asked include hernias. They love asking how to repair what is the good form of ventral hernia repair, about inguinal hernias. And then, of course, they're going to ask a question or 2 about pancreatic neoplasms and also liver nodules. Any test that we have taken so far, we always come across statistics, at least 1 or 2 questions. Even though it's not heavily tested, I think it's a good idea to review statistics before the exam. That way you have those solid questions answered and you get those points. Okay, so what I think is a reason for not succeeding or not doing too well in board exam. Of course, these are not hard facts. This is just something for you to watch out as. So if you have a history of not doing so well with standardized tests, then I think you need to get ahead of yourself and start early. This is not a hard, fast number, but according to some of the research out there, they've noted that ABSITE percentile, less than 30%, is noted to be associated with a higher rate of board failure. They also talk about lack of familiarity with concepts. And these concepts are just the basic concepts that you will build upon to become a PGY 3, 4, and 5. If you don't have familiarity of these concepts, then you're more likely to not do well because you are going to build on top of those concepts. And then, of course, they also talk about some of the red flags. So like if you were told repeatedly that you did not answer questions, or you didn't do well throughout your rotations, or you did poorly in the rotation, then that's something to look out for and improve upon if you're able to. Some common mistakes to avoid, definitely avoid is, again, and I'll repeat this again several times before we end this, is don't wait till the end of your PGY year or post-residency to start prepping. Realize it or not, those 15 days are not enough to review all the topics you have, nor to do questions that you would need to do so that you feel comfortable taking the exam. Also, do not take ABSITE lightly. There is a tendency to do so because we started residency, we're already busy doing stuff. I was. The first year I didn't do well on my ABSITE, and it's just because I took it lightly. I didn't study for it. And then I realized that it's a reflection of how much I feel prepared for my boards. So I started studying, and I slowly and gradually improved until I got to my 5th year, which was the best score I've had, which made me feel a little better, because now I knew that I was somewhat prepared for my boards. Again, I would like to say, don't take on too much too fast. Also, pace yourself. Don't try and do everything at the same time. Try and give yourself and your mind a break. And then also, don't be too hard on yourself. Finding time to study during residency is hard. We are on call. We have post-call days. The post-call days can be exhausting. The daily schedule can be exhausting. So it's okay to not find time during those days. But if that's the case, and if you have the weekends that you're not on call on, take time to catch up, or to go past what you have already assigned yourself in reading or doing questions. Something that is very helpful, either in a written form or in a mental form, is to determine how you're gonna plan your studying during residency and even after residency for your board exams. So I am more of a mental person, so my schedule was very specific mentally, and I would write down points in my notepad and my phone just so that I can look at it any day. But I outlined a detailed plan during my 5th year to tell me what I need to do to be able to finish my plans, my questions, my review before a certain time. As in, like, I wanted to be done with all my review before I ended residency, so that the last 15 days before my exam, I was spending on doing questions. Remember that knowledge is power. So that means that if you feel you don't know where to start, take a set of 200 questions. That could just be score. You could do Decker questions. You could do CSAP questions, and find out where you stand. And then once you find out where you stand, you can start reading, start prepping, start working on your weakness. And then from there, you can take those questions again. Again, make a calendar, outline a detailed plan, how you're gonna work through this, what topics you're gonna assess today, what topics you're gonna do tomorrow, what are your weaknesses? Again, start with your weaknesses. And then, as a surgical resident, remember, be realistic in your planning. That means that you do not have time during the week, then use the weekends. Or if you have a busy week and a weekend coming up, use the next weekend to catch up, or use the next week to catch up. You have to alter your plans, your studying schedule based on how your schedule is. Something else to keep in mind is to set aside time to select and dedicate yourself to certain study resources. As I said, you don't need everything, but you do need some things. And what you need is going to be determined by what you feel comfortable with, or you can also figure that out by talking to your co-residents, to your recent graduates, to people that have taken these exams, and find out what they used, what worked for them. Do your research and see if this will work for you. I made it a point to, every time I had a future fellow that I was going to talk to, or I had attending that had just graduated from residency and just taken their boards, I would ask them what they used. And I would also talk about the resources I'm planning to use, and they would tell me whether they knew about it or they had used it, and so on and so forth. And based on that, I did determine my plan to find out the resources and use the resources. I also asked them about their study plans, and I also made sure to ask them what they did to succeed. The only reason I did that is because I wanted to make sure I do everything I can to succeed. Some of the resources that I can think of, only because I have used them, and I'm sure that there are many more resources out there. I would say that during your first and your second year, definitely stick to SCORE, Decker, TrueLearn. Those are very good question Qbanks, and they do a great job in getting all the points across. Starting third year, I started using CSAP just because those questions are, at least to me as a first and a second year, were quite intense, and I don't think I knew my concepts enough, or I did not have that much of a surgery base to read those questions and to understand the questions that they were, the answers they were expecting me to have. So starting my third year, I started using CSAP, and post-residency, I continued to use RESAP. So I tried to go through those CSAP questions twice. I used a few score questions after my residency based on the topics that I was concerned about, and those topics were liver, endocrine. Those were my weaknesses. So I used those question banks, those questions from SCORE. And by the end of it, after doing CSAP and those questions from the SCORE, I felt pretty comfortable in being able to handle any question they were going to throw at me as far as liver or endocrinology was concerned. So now a little bit about the certifying exam. What is the certifying exam? It's a prometric exam. You actually go to a prometric center like you did for your step 1, step 2, step 3, and take an exam there. It's a qualifying exam. Again, you need to take an oral exam after that, so which is what I'm preparing for right now. It's a 1-day exam lasting for about 8 hours. It is administered in 415-minute sessions. There are optional breaks, but there is also a scheduled break, which is 40 minutes, which is between session 2 and 3. Just know that just like steps, once you exit from a session, you cannot come back. So, but you can be in that session as long as you have the time allotted to you. There's a total of about 300 questions. And the reason why I say that is because sometimes they will throw extra questions in there. So approximately 3 questions, but more likely than not, there will be questions more than that. So I talked a lot. I have a few questions that I think it would be nice to go through together. I would appreciate if the audience from whoever is here could answer this and could help me out answer this question. I will read it out for you guys. So a 35-year-old woman presents with a 5-centimeter breast mass. She has large pendulous breasts. The mass is well circumscribed on mammography and ultrasound. The core biopsy reveals stoma with, I think it meant stroma, with spindle cells and clefts, making a leaf-like pattern. What procedure should be performed? And your options are A, mastectomy, B, lumpectomy with sentinel lymph node, C, lumpectomy with 1 centimeter margins, D, an enucleation of the lesion, E, a mastectomy and sentinel lymph node biopsy. Can anyone tell me what's the diagnosis in this question? You can type out your answers in the chat box. I think the clue is in the core biopsy results, which is spindle cells and clefts making a leaf-like pattern. Does anyone? Yeah. Perfect. It is Phyllodes tumor. So what's the treatment for Phyllodes tumor? Would you do a mastectomy? She has large pendulous breasts. Would you just do a lumpectomy? Would you do enucleation of the mass? So now that we know it's Phyllodes, do we know, is it aggressive or a benign tumor? Is it a malignant or a benign tumor? So Phyllodes is an aggressive tumor. It's not benign. So I would call it a malignant tumor. If it's a malignant tumor, enucleation is not something you do. What about a sentinel lymph node biopsy? Do we need a sentinel lymph node biopsy with a Phyllodes tumor? So Phyllodes tumor is a type of sarcoma. Sarcomas don't spread via lymph nodes. They spread hematogenously. So most of the time, these tumors don't require sentinel lymph node biopsy. So the way, okay, so before I tell you guys what's the answer, can anyone tell me what they think is the answer? Anyone? Yep, perfect. It is C. Good job. So before we move on, I will tell you how I assessed and addressed this question, just because it helps when you try and eliminate majority of the answer choices. So in this question, they told you it's a 5 centimeter mass. However, they did tell you patient had large breasts. When a patient has large breasts, chances are that this patient does not need a mastectomy. Just because if it's large breast, even with 5 centimeters, there's a chance that you won't leave them completely disfigured. This patient doesn't need a lumpectomy, or sorry, can get a lumpectomy. However, doesn't need sentinel lymph node. Again, as I said, sentinel lymph node is not something you do for Phyllodes tumor because they spread hematogenously. So I ruled out B and E just like that. Again, I told you that enucleation is not something you do for malignant tumors. So lumpectomy with 1 centimeter margin is the right answer. Again, this is explaining the same thing. Again, sorry, Phyllodes are somewhat malignant. They are not completely benign, but this is the explanation that the source that I used gave me. So I apologize for that. The excision is with 1 centimeter margin. Okay, I have one more question. Again, I will read it out for you guys. A 60-year-old woman presents to the clinic with complaint of chest pain for 1 week. The pain is located in the middle of her chest, aggravates while eating, is relieved with belching. Patient has a long-standing history of dyspepsia and regurgitation for which she takes prescribed PPIs, as well as over-the-counter antacids as needed. Her temperature is 98.6, blood pressure is 130/90. Her pulse is 100 beats per minute. Respiratory rate is 20. BMI is 24, and physical exam is unremarkable. Her chest x-ray is attached. Which of the following is most likely diagnosis? So I have a chest x-ray here, but it's pretty small. So I put a chest x-ray in a larger format. I'm gonna let you guys take a minute, look at it, and then I will go back to the answer choices. Okay. I hope you guys had enough time to look at it. I'm going to go back to the answer choices and I'll come back to this x-ray one more time if you guys need it. Ooh, sorry. The answer choices are peptic ulcer disease, lung abscess, paraesophageal hernia, Barrett's esophagus, and cardiac myxoma. Well, I almost gave away the answer. If I didn't, can anyone tell me what they think the answer is? Yup, the answer is a C. So before we go on to next, how do we identify that? So, you know, I'm sure you guys are getting pretty good at looking at x-rays, or if not, have already gotten good at it. I try and look at the same things every time. I look at the airway, I look at the lungs, then I go to the cardiac silhouette, and then I try to look at the diaphragm. As you notice, this bubble right here, the gastric bubble, shouldn't be here. It definitely looks like it has made its way through the hiatus and is in the chest, which it shouldn't be. So whenever you have a gastric bubble or some kind of organ that's not supposed to be there in the organ, it's a hernia, and more likely to be a paraesophageal hernia. So that's what they're pointing out here. They're trying to show you this here, highlighted it. This is a gastric bubble. And then just based on the exam that or symptoms that she reports, she's more likely to have a paraesophageal hernia than not. And then lastly, our role as MST. So I will say I'm a very proud MST tutor. I love teaching. I love interacting with my students. What you get with MST is we will help you do a one-to-one tutoring We help you develop a schedule and work on the schedule if you need to. We also have, all of us are pretty flexible and are available, so we can adapt our tutoring sessions to what you need. And then, of course, we have regular communications and we offer mentorship. We also offer strategic planning sessions and also ABSITE tutoring. Again, I've been there. I know how you guys feel. Just know that you can do it. Just start preparation early and you'll be successful no matter what. I will take any questions if you guys have any questions. Okay, so someone asked me, what is the biggest mistake I think I've made during my prep? I think one of the biggest mistake I made during my prep is not starting soon enough. I don't think I stuck to the part where I should have started on a day one. I should have started day one. I did not realize how difficult this was going to be until I got my ABSITE scores. And I was like, whoa, this is not me. This has never been my score. What happened? And then I decided to work harder. Of course, you're already a year behind, so it takes you much more to catch up, which is what happened. But I took my time. Every single time I had, I would try and read, or at least I tried to do questions. Questions were my best friends. So they worked really well for me. Again, 5 years of residency is hard. You've worked really hard to get there. You've worked even harder before then to get into a surgical residency. So, just take time, take whatever time you have to study. But at the same time, just remember, it's okay to take a breather. It's okay to go have fun for a little bit. Just know that you will have tasks and studying and books waiting for you when you come back. We are here at MSD if you think like you need to talk to someone or need an advice. So come find us if you need us. In the end, I would like to thank everyone for coming. Thank you for your time. And I hope this was really helpful for you guys. I wish you guys good luck in your future endeavors and have a good night.